So before you start this video, please consult with your healthcare provider. Absolutely. Today's day and age, we have technology. Bring your smartphone, show your physio, whoever you're seeing because of your injury in your abdominal area, this video, show them what we are suggesting, and they can give you the yes, go ahead, or no, maybe skip that exercise for now. Really important to really have a healthy relationship with them, but also to listen to your body as best as you can. Good luck.
All right, so before you get started on your video, we want to talk about your transverse abdominis, and that is the one area of your abdominals that run from one hip to the other hip. The muscle fibers actually go across your body, just like a corset. So there's no way that you can really crunch those abdominals. So with the rectus abdominis, the chiclets or the six pack, when you crunch it, you feel that bulging. So how do we activate our TA or our transverse abdominis? We're actually gonna ask Kat to cough. So I'm gonna have her do it one more time, and I want you to look at her pelvis. It will naturally lift and strengthen. Very good. So basically, if you're finding that you're not connecting with the activities or the exercises, try doing them with a cough just to start. And remember, you're doing this in the privacy of your own home. And as you become more comfortable, then the cough will be eliminated and replaced with great breathing. Awesome.
Slowly begin to lift your knees to 90 degrees. And while pushing your knees into your hands, start to push your hands into your knees, creating resistance from both ends. Try and press your low back into the earth, and as you resist your hands and knees, do not let your abdominals bulge. Try and keep that low back connected down. Try and do this, releasing and inhaling and exhaling for up to 12 reps. Slowly begin to flex your feet and lower one heel down towards the ground at a time. Inhaling as you go down, exhaling as you come back up. Be mindful you are not arching your back here. If you do begin to arch your back, please just lower halfway down with your heels and maintain control of that core. It's all about muscle versus momentum here. The reverse crunch, starting at 90 degrees, inhale to prepare, and exhale, lift and pelvic tilt your hips slightly towards the ceiling. Return back to 90 degrees. Really take your time with this one. Move with your breath. It is completely a slow movement. If you're going fast, your deep core is not being utilized and you're putting too much pressure on your low back. Next, we have the pelvic tilt. So inhale, prepare, and exhale, just a little tiny move of your pelvis. You're just lifting it up and then returning it back to a neutral spine. This is just like the motion of zipping up tight pants, and you really want to focus on bracing your core, your deep abdominals as you lift that pelvis up. Next move we have is a hip bridge. And we really want you to focus on really squeezing the glutes as you lift up slow and controlled. A slight pause at the top and then lower down and completely reset your spine here. This is not about how many reps you can get in, but on how good the quality of those reps become. We really want to focus on pressing into the heels, and you can have your hands softly at your sides or on your hips. And what you want to focus on is that your hips are lifting evenly and at the same time, that you're not getting a drop on one side versus the other. Just do up to 12 reps here. Next, we're progressing to the crunch. Now with this crunch, in any way that you have an injury in your deep core, it's important that your hands remain across your chest. Do not pull or heave on the neck at any time. So again, we want you to inhale to prepare, and on your exhale, slowly lift just to the point where you feel control, and then lower down. And if you're looking at Kat, her neck is neutral. It's not looking upwards, and it's not down towards her chest either. We want to keep that natural curve of your spine where you feel that you can breathe without constriction. And just take your time here and do as many reps as you can.
So let's talk breathing a little bit. If you have an abdominal injury, a hernia, or a stoma, we want you to think about yoga breathing or deep belly breathing. If you carry a bit of extra weight or know someone that does, you'll notice that their breathing or your breathing is louder. It's mostly in their chest. That is really overusing your lung area, and that can cause a lot of issues. So improper breathing over a long period of time can end up with, you can end up with more herniations, you can end up with disc problems, and also some hypermobility. So really focusing on that deep breath going past the chest and into the belly. Almost like Buddha, just expand that belly and then totally exhale, lift it up and out. So really take some time, try and do some yoga breathing at least once a day and really, really get in tune with how your breath is.
Rock it out, guys.
All right.
Okay, so nutrition is the crutch to healing a hernia or a stoma, pretty much anything in the core trunk region. So basically, if you're not putting the time in the kitchen, okay, you can't expect to see those results. So kitchen is core.